Hi guys, welcome back to my YouTube channel. Today on this channel I'll be talking to you about vaginal yeast infection. Did you know that studies suggest that 9 out of 10 women will have a vaginal yeast infection at least once in their life? Hello beautiful people, welcome back to the channel. To my new subscribers, I see y'all. Welcome. We talk about health issues, health trends, and everything health basically. So please, you're in the right place. And if you're seeing my video for the first time, please subscribe, click on the like button to encourage me. Thank you. So let's get right back into what we were saying. So vaginal yeast infection, also called candidiasis, is an infection that is caused by a fungus called Candida albicans. This is naturally occurring in the vagina. At the end of this video, you're going to be learning the causes, because apart from the fungus being naturally occurring, there are other things that can trigger a vaginal yeast infection. So I'm going to be telling you about the causes, the symptoms, the treatments, prevention, and when to seek medical attention. So please stay to the end of this video to learn all of that. These are possible causes of a vaginal yeast infection. Like I said, it is caused by a fungus called Candida albicans, and it is naturally occurring in the vagina. Now, there are situations that can stimulate overgrowth of this fungus. One of such is hormonal changes. Hormonal changes in pregnancy, menstruation, menopause can actually trigger a yeast infection. Also, if you are diabetic, you know what they say about relationship between yeast and sugar. If you're diabetic, you can come down. You may notice that you frequently come down with a vaginal yeast infection. Also, if you are immunocompromised, like maybe you have HIV or you take immunosuppressive drugs, you are predisposed to having candidiasis often. Broad spectrum antibiotics, that's for people that like to abuse antibiotics. You take unprescribed doses of antibiotics. Anything that happens to you, just think, oh, I should take an antibiotic. So some broad spectrum antibiotics can also predispose you to having candidiasis. The last cause I'm going to talk about is one of the most important, and most ladies are very guilty of this last one. So an imbalanced pH can cause you to have an overgrowth of this fungus, leading to you get an imbalanced pH when you insert things, you know, all these insertables you all buy online. When you buy all those things, they tell you it's going to make it smell flowery, smell like berries. I don't know, they just sell you this weird idea. So when you stick things in there, you actually upset the pH of the vagina, which is really acidic at around 4, and when you upset it, this can cause an overgrowth of candida. So symptoms of a vaginal yeast infection range from itching and burning. You may experience itching and burning in the vagina, the vulva, and surrounding areas. You may also experience redness and swelling. That's still in the vagina, vulva, and surrounding areas. You also notice a thick whitish discharge, like cottage cheese. It usually has no smell. So you may notice this, and you may also notice that the itching comes mostly at night, because that's when the fungus is really active. You will experience painful urination. That is burning sensation when you're trying to pee. This is as a result of fissures or tiny cuts you've left as a result of intense scratching. There is also discomfort during sex. So for treatment, if you've experienced any of the symptoms that I mentioned earlier, you should get yourself to a lab first. When you get to the lab, you'll be required to do a high sensitivity swab. So they'll take a swab from your vagina and culture it. That's to really confirm. There are some labs that it is mandatory that you do a urinalysis alongside it. Now I'm going to tell you the importance of the urinalysis. So the urinalysis will help you rule out things like diabetes that I mentioned, because if you're always coming down with a vaginal yeast infection, like I said, you're more predisposed if you're diabetic. So when you do a urinalysis, it will indicate if there's like a high amount of sugar in your urine, meaning this is actually the trigger. So I'd advise, if you're going to take that swab test, you should actually do it alongside a urinalysis. You may be prescribed antifungal topical meds that you can get over the counter depending on the country you live. You can get a topical cream to relieve itching, especially at night. Also, a single dose of fluconazole, which is an antifungal, will actually help your condition. So disclaimer as usual, this prescription is not for you. Yes, you heard me correctly. This is not a prescription for you. So if you have this condition, please try to seek medical attention, especially if it's severe, persistent, and accompanied by fever. Also, if you're pregnant or you're diabetic, you should seek medical help. You should also seek medical help if it's your first time of being infected, and also if you are uncertain about your diagnosis. Maybe you've not even gone for a lab test. Please, this prescription is not for you. Seek medical help as soon as possible. So I'm going to be telling you things you can do to prevent reoccurring yeast infection. The first thing you're supposed to do is to wear breathable underwear. This cannot be underemphasized. Do not wear latex underwears. Wear cotton underwears. Practice good hygiene. This cannot be underrated. Please keep the genital area dry and clean at all times. You should also avoid harsh or scented products, douches, bubble baths, all those things you dip yourself in. Please avoid harsh products. This can also be a trigger. So try to manage stress. Eat balanced diets that include probiotic rich foods like yogurt. So we've come to the end of this video. Please, if you've not subscribed, this is the right chance to do that. Please subscribe, click on the like button. I'll be in the comments to answer any questions that you have. So please drop your questions, feel free. Thank you so much for staying to the end. Till next time. Bye.